So myofascial release for the gastrocnemius and the calf. We would use this where we felt fascial adherence in this area of the calf. This often occurs between the two bellies of the gastrocnemius, where the two lots of fascia merge. If this was the case, we could do a direct myofascial release, working directly into that fascial restriction with reinforced thumbs, using a slight amount of oil or wax to help with the movement, but not too much that we slide too quickly. We would sink into where we feel that resistance in the fascia with reinforced thumbs and slowly, directly move through that fascial tightness. Important to keep the speed nice and slow to bring about a stretch or a creep on the tissues to change the length of that adhered tissue. I would continue to repeat that until I felt no longer adherence or restriction in that fascial tissue, or until I felt less crepitus in the fibers, or until the patient felt subjectively that it felt easier. I could also use an indirect myofascial release to treat adherence in this area. For that, I would put a gentle tension onto the fascial tissue with a flat hand, and holding that fascia, I would then get the patient to actively contract the muscle underneath to try and free that muscle from that fascial restriction. So we ask the patient to pump their foot up and down, contracting the gastrocnemius muscle whilst holding that lock on the fascia. I would get them to continue to do that until I no longer felt a pull of the fascia as the muscle was contracting.